The antibody treatment given to President Trump when he contracted COVID-19 is now coming to South Florida.
And Local 10's Christina Vasquez joins us live from Pembroke Pines with where and when Regeneron will be available. Christina.
This is exciting news coming out of Memorial, especially when it comes to some of these new treatments we're seeing coming online. You have to remember the FDA just approving this treatment last month. But let me step out of the way as I kind of walk you through where I am. So it's available at Memorial Hospital Pembroke. That's where I'm joining you live from. This is the outpatient area next to the emergency room. There's two companies that have produced this antibody cocktail. One is Regeneron, which you mentioned. That is the one President Donald Trump took when he was diagnosed testing positive for COVID, if you remember, in October, and the second being produced by a company called Eli Lilly. Now, both companies have said that this treatment helps reduce viral levels, and this is where it gets really interesting. By having this treatment in outpatient, if you can get it within it's a critical 10-day window, according to medical experts, from when you test positive to when this is most effective, guess what? That keeps folks out of the hospital, which certainly helps with our hospital capacity issues. Let's listen in together a little bit more with Chief Nursing Officer here at Memorial Hospital Pembroke, Dr. David Starnes. Let's listen together.
So I guess a good way to think about it is this is one of the drugs that they gave to the president whenever he was sick. And basically what this drug does is it targets the spikes on the coronavirus and allows it to not attach to the body, to any of our cells, therefore allowing you to create some immunity. And there is a sweet spot. There's that window of about 10 days that we need to catch you in before you're really, really sick. We can't give it on the back end, but we can give it on the front end. And by doing so, we can actually keep patients from having to get sicker and use the emergency department, and keep people from, after the emergency department, making it to an inpatient bed on the other side of the facility.
And in order to be eligible, they're really targeting that at-risk community. So over 65, or if you're over 55 years old and have an underlying health conditions. Now, appointments are necessary. I sent all the information in terms of the eligibility requirements and how to learn more about this to our digital team just moments ago. So they're going to be working on getting that for you on local10.com. So certainly check back in there throughout the day. But again, the target population for this is over 55 with underlying health conditions within 10 days of testing positive for COVID-19. Reporting live for you, I'm Christina Vasquez, Local 10 News.